Hey guys, so we are back and we're going to discuss the cardiac drugs and cholesterol lowering drugs today. So these are really important. I know I say that about like everything, but there's a lot of cardiology, cardiac drugs, heart drugs on this your certification test. Probably because high blood pressure is one of the most common like diseases or conditions in adults. So there's a lot of drugs that treat it, and that's one that we're going to talk about. And there's a lot of sub-classifications. So when you're filling out your chart, you need to make sure that it goes in the right sub-classification of hypertensive drugs, antihypertensive drugs, because most of them are going to be antihypertensive drugs or have that effect, but they're going to have a sub-classification as well. So I'm just going to get started and then you can see what I'm talking about. Sorry, I have gum in my mouth right now, you guys. Supposedly it's supposed to like keep you more awake and more alert and less like yawning less, because I like in all of my videos I'm just like yawning the whole time. So I'm really sorry, guys. I feel so weird about that. I don't know why. Okay, so hopefully you can see my slideshow. Okay. So reasons for using cardiac medications. I hate this thing because I have to go through all of them. Okay. I made part of this lecture and then I got it from someone else, and then I like kind of changed it to my liking, but they have some fancy things on here too. Okay, so angina is one of the ones. That's probably not the number one, and that's basically acute chest pain. And then we have hypertension, which is high blood pressure. Arrhythmias, so your heart beating faster or slower all of a sudden. Cardiac failure or congestive heart failure. So you'll see the abbreviation CHF in a couple places sometimes. Fluid retention leading to cardiac conditions. And most of the time, fluid retention can be associated with hypertension also. But it can also be like a combination of things. So like people who have congestive heart failure, most of the time will be on a drug to help with fluid retention because they will have fluid retention, but a side effect of fluid retention is hypertension. Does that make sense? Probably not, but we're going to go through it. So myocardial infarction or a heart attack, and then coronary artery disease. Okay, so there's lots of different things. You can have multiple of these things at one time also. That's something to note. Okay, so the most common, I said that was hypertension. It is the leading cause of cardiovascular disease and mortality, which is death. The disease symptoms and organ damage caused by hypertension are not evident until 10 to 15 years after the disease has started. So they call it the silent killer for a reason, because people can have this issue for years and years and years. Some people know they have it and they don't take it seriously. They don't take medication for it. They don't see a doctor for it. And a lot of times, like, some people even think that, if they're not overweight, then they're fine. Like they don't have anything to worry about. But like, that's not the case. A lot of times it can be managed by diet and exercise, but sometimes not. You'll see people who look completely healthy, who work out, eat healthy, all those things, and they somehow have hypertension. And there's just a lot of factors that are factored into it. I mean, lifestyle factor is probably number one, but there are some genetic components as well. So that's something to know about. Proper medication and patient compliance will control most cases of hypertension. Causes of hypertension: most people have essential hypertension where the exact cause is not known. Increased sympathetic activity and sodium overload, increased blood pressure. So, but it is a little bit, I guess, like lacking to just say that, well, it's because you're eating too much sodium. There are more things than just sodium overload. You know what I mean? So you can't just avoid sodium and then avoid hypertension. And in fact, sodium is an important compound that you need in your body to like balance things out. So sodium is like salt, you know. Renal disease and increased renin, angiotensin, aldosterone activity raise blood pressure and cause sodium and fluid retention. Smoking, body overweight, stress, and increased sodium consumption can contribute to hypertension. I think a lot of doctors just don't know. You know, they don't know exactly why. Some people might be more susceptible to others than others. So it depends on the person. But that's why everybody needs to be aware that this can be an issue. Drug subclasses used to treat hypertension. So you've got beta blockers, calcium channel blockers, ACE inhibitors, angiotensin 2 receptor blockers, vasodilators and nitrates, diuretics, anticoagulants, and antiarrhythmics. That's a lot. A lot of these don't just treat hypertension also, they can treat other conditions, heart conditions as well. So there are drugs underneath all of these that you would need to know, and you would need to know that they are a beta blocker or they're an ACE inhibitor or whatever. Basically, the reason why there's so many subclasses is because they do different things in the body. So, for instance, diuretics, they will take out excess fluid in the body. And so if a doctor thinks that that's going to help that particular patient with whatever issue they're having, maybe they have congestive heart failure and that's their main issue and what's causing the hypertension, then they might give them a diuretic. And then if it helps, great. But if it doesn't, then they can go to like another subclass to help. So they work on different things in the body to bring about a change in the hypertension, because there's just so many factors that can affect hypertension, and some people are on multiples of these, which kind of sucks, to be honest. But okay, so we're going to start with beta blockers. Okay, so for example, probably I would say the number one drug out there that I hear most often prescribed for hypertension is atenolol, or any of the OLols. Atenolol's one, or propranolol. The OLols are really common. Another one is lisinopril, but we'll go over that here shortly. But atenolol and propranolol are two of the main ones. Metoprolol. So the OLOLs are beta blockers, and that's something hopefully that you'll remember, because a lot of times they'll put that on the test. They'll put those types on the certification test and want you to know what subclass they're in. So that's one way to remember all of these is like the OLols go in beta blockers. You know, they decrease the heart rate and cardiac output, which lowers blood pressure and makes the heart beat more slowly and with less force. Used to lower blood pressure, used with therapy for cardiac arrhythmias also, and can treat chest pain or angina as well. And then used to prevent future heart attacks in patients who've already had a heart attack. That's another thing. All right, so the next one's calcium channel blockers. For example, we got Procardia, Cardizem, and Norvasc. So I'm pretty sure all of these made the top 200 list. I changed the top cardiac drugs because they've updated a little bit, but most of these on here will be, but you'll have to see like whatever's on this. I would say go off of what's on your top 200 drug list and learn those. I'm not going to be testing you on the PowerPoint specifically, if that makes sense. So, but these, I think, all ended up on that top 200 list. But calcium channel blockers interrupt the movement of calcium into the cell of the heart and blood vessels, and may decrease the heart's pumping strength and relax blood vessels. And used to treat high blood pressure, chest pain, or angina caused by reduction of blood supply to the heart muscle, and some arrhythmias as well. Okay, so we got vasodilators. So one major example would be nitroglycerin, and apresoline also, but nitroglycerin is one that's commonly asked about on the certification test. Most of the time, what they ask about nitroglycerin, which actually I think there might have been 2 questions on that last year, but I can't remember what my students said. You know, they come back and kind of like tell me what they remember. But nitroglycerin, I want to say the one question they asked was about how it has to be stored, because it has to be stored in its same airtight container that it comes in. It can't be redistributed to a new container. So you have to sell it the way that it comes from the quick opening bottle. So it opens quickly for someone who's having an angina attack and you need that medication very fast. And so it doesn't have child-proof packaging. So that's another question they might ask is like about nitroglycerin. It is one of the only ones that is not allowed to have nitroglycerin, or not allowed to have child-proof packaging. So it's exempt from that. And then also it's light sensitive, so so it has to be in a light a container that that reflects light. So usually like a amber colored bottle. So I think those are all of the questions that they ask about nitroglycerin, and just that it treats angina or chest pain. It dilates the veins so less blood is returning to the heart. Therefore, the heart does not have to pump so hard and fast. So yeah, pretty much that's what you need to know. It's kind of a fast-acting medication. I think apresoline is not fast-acting. Like it's more like it's not something you're going to use right away. It might be something you use like a daily medication. Nitroglycerin usually isn't like a daily medication. It's usually something that you use like right then. And continuing with vasodilators, the drugs stimulate the formation of nitric oxide, a potent vasodilator of blood vessels, which means it opens up the blood vessels. And then that can actually lower blood pressure just from like what it's doing in the body. Okay, and then ACE inhibitors. This is the lisinopril, prinavil, zestril, enalapril. So all the prils, PRILs, they are going to be ACE inhibitors. So that's how you can remember that. They expand blood vessels and decrease resistance by lowering levels of angiotensin 2. Allows blood to flow more easily. It makes the heart work easier or more efficient. Used to treat or improve symptoms of cardiovascular conditions, including high blood pressure and heart failure. Lisinopril is probably the most common. It's one of the most common drugs prescribed for hypertension as well. You'll notice that. I mean, I think it's on like the top 10 list, actually, of the top 200. I think it's on the top 10 list. Angiotensin 2 receptor blockers, also known as ARBs. There's a couple of these that you need to know: Cozar or losartan, and then valsartan or Diovan. So the sartans, maybe that'll help you remember. So this actually blocks or prevents the chemical from having any effect on the heart. Instead of lowering levels of angiotensin 2, it like blocks them. So it keeps the blood pressure from rising, and is used to treat or improve symptoms of cardiovascular conditions, including high blood pressure and heart failure. All right, and then antiarrhythmics. Lanoxin and Cardarone are 2, I think, that are still on that top 200 list. Those are examples. Increases the force of the heart's contractions, which can be beneficial in heart failure and for irregular heartbeats. Used to relieve heart failure symptoms, especially when the patient isn't responding to ACE inhibitors and diuretics, because like I said, they will probably start that patient off with an ACE inhibitor or a diuretic or both, but if they're not responding, they can always change to something like this. Also slows certain types of irregular heartbeat, particular atrial fibrillation. All right, and then diuretics, we talked a lot about. Oops, sorry guys. So for furosemide or Lasix and spironolactone, both of those are probably the most common. Microsize too. I always usually see Lasix or spironolactone as two that are really common. They just get rid of those excess fluids in the body, help the heart's workload, increases buildup in the lungs of fluid, and other parts of the body. So it takes away a lot of the excess water in the body, which people who have congestive heart failure or even sometimes high blood pressure will have that excess water or fluid consumption in their body. And so this helps. It takes that swelling out. Okay, and then anticoagulants. So this is going to be a blood thinner, commonly prescribed, including heparin and warfarin or Coumadin, and then OTC meds like aspirin. You've heard probably of some people taking a daily aspirin every day, and a baby aspirin. So this is a way it thins the blood to help the blood get through the artery easier. It does decrease clotting ability of the blood though, which can, affect patients if they are, taking too much or not, or if they're not being, regulated by a doctor and watched by a doctor, because that can be really dangerous. We've talked about this before. It can be dangerous being on blood thinners because if you have if it decreases the clotting completely, or really, if it does its job really, really well, you could bleed out if something were to happen to you, like an acute issue. You get your leg cut off or and your arm cut off or something like that. You're going to bleed out quicker and probably die if you were on a blood thinner versus someone who wasn't. So that's really important to note. And it helps prevent harmful clots from forming in the blood vessels, may prevent the clots from becoming larger and causing more serious problems. So yeah, that is, but see, there's even side effects from this, I just found out a friend of a friend recently had a heart attack and stroke, and then they put him on heparin in the hospital to try to thin the blood out to help him, but it ended up actually causing him to have a brain bleed because the heparin is a really intense blood thinner, and I guess it caused bleeding on the brain, and then he ended up dying. So that was a side effect of a medication. It's sad. So sometimes they can be life-saving, other times they can cause problems too. And they're often prescribed to prevent first or recurrent stroke. Okay, so now we're going to go through cholesterol drugs. So cholesterol drugs are a little bit different than cardiac drugs. So cholesterol drugs, there's only a few of them. There's not as many as there are cardiac drugs, and they're basically, so high cholesterol can be a precursor to, eventually having a heart attack down the line. And too much cholesterol in the blood goes to your arteries and thickens the arteries up, and causes less blood flow. So cholesterol is that thing that doctors will check as a just as a check mark, do you have high blood pressure and do you have high cholesterol? How are these things looking? So it's a diagnostic tool, checking cholesterol, but then what do you do about it, right? So cholesterol medication overview. Various medications are used to lower blood cholesterol levels. Remember, cholesterol is fat. Also remember that cholesterol is a good thing. You need fat in your body because it pretty much works all the processes in your body to help you, make cells in the body, produce hormones. All of those things are really important for you to keep your body in homeostasis. So I'm not saying fat is a bad thing, just FYI, you just have to have a balance. Statins are recommended for most patients who have high cholesterol. Statins are the only cholesterol-lowering drug that has been directly associated with a reduction in the risk of heart attack or stroke. So statins are the first kind. They're the most common. This class of drugs, also known as HMG-CoA reductase inhibitors, work in the liver to prevent cholesterol from forming. I don't know how I feel about that, to be honest, because I feel like if you completely stop, making cholesterol, that could probably be bad. Like, are people's bodies really working, to their fullest if they're stopping cholesterol from forming? I don't know. So, yeah, I would say, you can definitely, by losing weight, diet and exercise, you can definitely help most of the time with high cholesterol, like lifestyle. Most patients can probably, change their lifestyle to affect their cholesterol levels. But if they can't do it somehow, then, the doctor might recommend them getting on something like this. So this reduces the amount of cholesterol circulating in the blood. Statins are most effective at lowering LDL or bad cholesterol. They also help with lower triglycerides or blood in the fats, and raise HDL or good cholesterol. Examples would be atorvastatin or Lipitor, probably the most common one, lovastatin or Mevacor, pravastatin or Pravachol, Crestor. It's not just calcium, it's something else. That might be like the wrong word. Let me see here. Crestor is rosuvastatin, so I don't know where calcium came from. That's not right. It's just a wrong word in here. And then simvastatin is Zocor. And a lot of these are on your list. Statins are also found in the combination medications lovastatin and niacin, Caduet or atorvastatin and amlodipine, and Virovirin, which is simvastatin and ezetimibe. Some of these actually help with, like amlodipine can help with high blood pressure too. So they kind of kill two birds with one stone. So big thing to note here, statins. Statins are important. So the suffix statin will tell you it's a anti-hyperlipidemic or anti high cholesterol drug. So don't forget that. That is like one of the biggest thing. They'll probably ask you to identify a statin or to identify like the name of it, or like they might say, which of the following is a anti-hyperlipidemic drug, and then they'll say atorvastatin as one of the answers, and you would pick atorvastatin. So because statin is in that word. Ooh, here I go, guys. Ooh, so sorry, yawning. Lipid-lowering drugs work in different ways to lower fat in the blood. So this is a different kind of drug. This is Zatia, which is that it's kind of like this one, Vitarin, but it's just ezetimibe as the main drug in this drug. Zatia is the brand name. And it works specifically by preventing cholesterol from being absorbed in the intestine. So instead of not making cholesterol, it actually prevents it from being absorbed. Some natural lipid lowering supplements. I added these in because they did ask about these. I don't remember them asking specifically what they were, but they asked what their names were. And so you'll notice that these two are not on your list for right now for cholesterol and cardiac drugs, but they will be on your list for supplements. We have a supplements list at the end, and it's like, vitamin C, the fat soluble vitamins A, D, E, and K, and omega-3 is on there. There's a specific drug that's come out that's omega-3, and it's prescribed for different things. So that's why I put it into supplements, because it's not always prescribed just for lipid lowering effects, but it has a lot of other positive things too that it does. And then niacin or B3, nicotinic acid. This drug works in the liver by affecting the production of fats. Niacin side effects may include flushing, itching, and upset stomach. Your liver functions may be closely monitored because niacin can cause toxicity. You have to be careful with that. Okay, that is the end. I thought that was going to be a lot longer than it was. So hopefully you guys were able to stay caught up here. Thank you so much for joining me today. Let me stop presenting. And I hope you'll have an awesome day. Bye, guys.